Good afternoon, everyone. Today is Friday, July 25th, 2025, and we welcome you to our Friday wellness webinar. This is where we talk about a variety of diabetes topics. And so today I have our head of the dietitian group, Caroline Weber, with me. So we're going to go ahead and talk through some of our standard things that we go through just so everyone is aware. First, I'd like to introduce our wellness program team. We have Kamal Erkin, who is our chairman of the United Medical ACO, myself, Donna Gunkel. I am the director of clinical integration and over this program as well as all of the clinical programs here in our ACO. We have Dr. Hundle, who is our program director. He is one of the endocrinologists we have within the network, and he is with First State Endocrinology. Caroline Weber is here today with me. As I said, she is our diabetes program coordinator. And then we also have, as part of our team, two social workers who are there to help support all of our members throughout the ACO. That would be Roxana Portlock and Carla Williams. And each month we try to pick a different topic that relates to everyone's journey with diabetes. And so we have a variety of providers who join us on a monthly basis. We often have Dr. Hundle, and he talks about a variety of topics, including changes with medication, different changes overall with diabetes treatment. We also have several of our cardiologists who meet with us to talk about the relationship between cardiology disease and diabetes. Our nephrologist, podiatrist, we've often had our social workers, physical therapist, and many other specialists. In fact, next month for August, our plan is to have Dr. Aparna Hasmani from Hasmani Eye meet with us to talk about the importance of eye exams. And so looking towards today, it will just be Caroline and I today. And so our topic is food without fear, dismantling diet culture in diabetes management. And so with that, I'm going to go ahead and turn it over to Caroline.
Awesome. Thanks, Donna. So, welcome everyone. Today we're going to explore this really important topic and really relevant topic, especially now in this current diet culture centered world. And we're going to talk about how many of us think about food and diabetes and how diet culture relates to that. So, first off, what is diet culture? Simply put, diet culture is a set of beliefs that value thinness and it promotes weight loss as a sign of moral virtue or health. And it often judges people based on their body size or eating habits. It tells us really that foods are good or they're bad, really black and white thinking, or that even a certain size or weight is the ultimate goal of being healthy or even worthy. And so, why is this important? It's important because we want to recognize how much it shapes a lot of the advice and messaging that we hear related to food or diabetes management. And it really starts to create fear, food shame, and guilt around eating, especially when we're managing such a complex condition such as diabetes, which already makes us super careful about how we look at nutrition and how we manage our blood sugar numbers. And this fear really can disrupt how we trust our bodies and how we enjoy food and really sustain healthy habits. So, if you're thinking about some real life diet culture examples, one might be maybe a clean eating obsession. You might often hear those words thrown around like I'm eating clean or pure foods. And this is implying that other foods are dirty or bad. And this kind of language can make people feel guilty or bad for enjoying everyday foods or treats, even if they do fit into a balanced diet. It also looks as weight as a sole measure of health. So we can hear this in the healthcare setting, in friends, or even social media, especially that emphasize, weight loss is the most important goal. Even when other health markers like blood sugar, energy, mental health are other more relevant ways to dictate health. So this can put pressure on people to really focus on the scale and rather than overall multifactorial well-being. We can also see this transpire into extreme diet trends, fad diets. We have a great presentation on fad diets. Maybe we can show later on, Donna, where to access all those other presentations that can shed light on, especially like up and coming fad diets that are pretty common that you see on the internet these days. Juice cleanses, detoxes that promote really quick fixes, but they're really unsustainable and really hard to manage long term. And these diets are promoted as a way to manage diabetes or to lose weight fast, which really ignore individual needs and preferences. We can also see food policing. I have a lot of patients who come into appointments thinking we're the food police if they've never interacted with a dietitian before. But you can also get it from family members and coworkers. And really, we want to step away from that food policing. It might sound like judgeful remarks, like you should eat that or you shouldn't have that dessert. And we as dietitians definitely aren't the food police. So keeping in mind, like these types of terms are not necessarily helpful to someone's journey. You could also see a visual example, like if you're scrolling on social media or looking on the internet, or even commercials have before and after weight loss photos. And advertisements or posts about this really show dramatic transformations. And this kind of sheds light onto thinking thinner equals happier or healthier, which can be a really harmful oversimplification and really promote unrealistic body standards and negative self image. So it's subtle but impactful, and it's why it's so important to really challenge these messages of diet culture to support healthier diabetes management. So, how does diet culture show up in diabetes care? Because it is absolutely present. When we talk about managing your diabetes, it's important to recognize how diet culture is widespread, right? It's about food and weight and how it can influence diabetes care and how we approach it. It shows up in really unhelpful and harmful ways. Some examples might be like an overemphasis on weight loss at all costs, could be carb shaming, unrealistic diabetic diets, fear mongering, which we'll get into, and they can leave us feeling really confused, like conflicting messages that we're seeing online. It can be really discouraging, especially when we're trying our best to manage our blood sugars and support our health overall. So, we're going to kind of explore some of these impacts and ways to build healthier, more balanced relationships with food. So we see an overemphasis on weight loss at all costs. And this is often a really strong focus on losing weight as the primary goal in diabetes care. We know that a healthy weight supports diabetes care, right? We know that it can help with regulate some of our blood sugar levels. But the message that weight loss is the only or most important factor can really overshadow other important aspects like monitoring your blood sugar regularly or nutrient quality or even like mental well-being and mental health. So, this overemphasis can really lead to unhealthy dieting behaviors where we're just trying to shrink ourselves, right? We're eating less or we're feeling like a failure if we don't lose weight quickly. And it's crucial to remember that health is going to look different for everyone. It's going to look different at every size. And success in diabetes management isn't about the number on the scale. There's so many more factors to it. We can also see it in carb shaming. So carbs are so sadly unfairly blamed for diabetes care, which can lead to a lot of shame and guilt around consuming carbs. Creates a lot of confusion when you're trying just to fuel your body through the day. Do you eat carbs? Do you not eat carbs? What type of carbs? And carbs are essential for energy, overall health wise. So it's really important to focus on which types of carbs, the portions, and how they work best for your body. And this mindset really encourages flexibility and reduces stress around eating in general. So we'll dive in a little bit to types of carbs and Carbs 101, but carb shaming can definitely be how it shows up, diet culture shows up in diabetes management. We got unrealistic and unsustainable diabetes diets. I hear of a new diet every day, and they're crazy out there thinking like you just add salt to your water, it cures your diabetes. Really, really bold claims that are not backed by science. And diet culture often promotes a one size fits all approach, right? Everyone's the same, so every diet's going to work for every person. And that's just not the case. Everyone is completely different. Diabetes is a very individualized disease. So we want to make sure that we are treating the individual and not just using a one size fits all approach. These diets can really be discouraging. You can often see binge and restrict cycles of overeating and heavily restricting, which can then, hurt the metabolism in general. And sustainable diabetes care is all about finding an eating pattern that fits your life and that we can enjoy over time. We're not looking for a temporary fix here because diabetes can be chronic, right? We want to make sure we are with you with a sustainable eating pattern over a long period of time. Especially nowadays, we also see fear-based social media messaging. So social media, it really amplifies kind of fears surrounding food and diabetes. Every day you see a new post that don't eat this, don't eat that. I saw a post yesterday that said chia seeds are bad for you. And I was like, totally not based on science. And so some people who are unaware or not sure how to find a credible resource might believe that. And that's honestly very dangerous because then you start to remove food groups. Then you start to have fear around food and anxiety that you can't do anything right. So it kind of creates that shame cycle and the guilt cycle. So, really, fear based messaging can be detrimental to diabetes care. So, diabetes culture influences diabetes care and can lead to focusing way too much on weight as the sole, measure of health. You feel guilty about carbs, following these unrealistic diets, and overwhelmed by fear-based messages. And the goal is to move to a more balanced and compassionate approach that supports your unique needs and overall well-being.
So Caroline, and I'm trying to put myself like in the place of a patient. What are the potential psychological and physical consequences of promoting restrictive diets in diabetes care?
Good question. Psychologically, right, it can increase, of course, that anxiety and fear around food. It's going to give you some guilt and shame and contribute, especially to disordered eating behaviors, like binging, food obsession. There's even orthorexia, which is when you're overly obsessed with making like eating perfect. And a lot of people don't recognize like the symptoms of these disordered eating patterns. Disordered eating is on a scale, right? Some are more towards the thought process, some are acting upon disordered eating patterns. So, over time, this really kind of breaks down your self trust, your body image, and it leads to decreased quality of life, even. And sometimes even depression, right? You're just so fed up with trying and you start to go down a spiral where it's not even worth, making the right choice because you've already messed up. So physical and extreme restriction, we know also causes blood sugar instability. And you see nutrient deficiencies, weight cycling, which has even been shown to cause issues with worsened insulin resistance and heart health. So ultimately, like a rigid dietary rule can undermine really long-term diabetes care and self-management just by creating really unsustainable and fear-driven food approaches to how we eat and the foods that we choose. So we really want to make sure that we focus in on eliminating all of this diet culture centered talk and thought processing to help create a better and more sustainable relationship with food and improving mental health in that aspect too.
Caroline, so
Yeah.
never mind. I
Mm.
think for some reason it looked like it went back a slide and now, but now I think you're on the right slide. Sorry. I just wanted to make
No.
sure we were showing the
Um,
right one.
and since we're talking about food fear and fear mongering, there are some dangers, right? We're talking about psychologically the impact. Food fear mongering can lead to really high levels of stress, and that fear mongering is like when you hear those messages that this food is toxic or this food's going to do this to you. And that creates a lot of anxiety. There are people who make their living walking around grocery stores and posting online telling you what foods not to eat. And that can create a really harmful environment that makes eating feel like more of a source of danger rather than nourishment. And this fear can really cause emotional stress where you're worrying about everything you're eating. It's overwhelming, it's exhausting. Like, I just can't, find foods that sound healthy or look healthy. And that's where the eating disordered behaviors start to come, right? You start to feel fear, then you go into a restrictive eating pattern, and then you binge because you've been restricting, and then you're avoiding social situations involving food. So you can see this as like domino effect, where it starts to impact quality of life. And then we have a negative mindset around it, where you've got constant anxiety or feelings of shame about your food choices that really takes a hit on your mental well-being. So living with this fear makes it even harder to enjoy meals and trust your body to maintain that healthy and balanced lifestyle. And then even a lot of people don't think about the nutrition consequences of this, right? If our fear is driving your food choices, it's often resulting in poor nutrition. So you're avoiding entire food groups or categories based on the fear rather than the evidence. And then we see like nutrition implications like deficiencies. If you cut out all carbs, you're losing out on fiber and vitamins and minerals. If you're cutting out, dairy, right? Calcium is really important. So you're putting yourself at risk for some of these nutrition complications. Unbalanced meals, even, we know extreme restriction, it's going to disrupt your macronutrient intake. So, right, your blood sugar is a little bit more unstable. And then really unrealistic diets, of course, like eliminating things without professional guidance is really unsustainable. So then you've got kind of all over the place weight cycling, blood sugar ups and downs, which of course isn't going to make you feel great either. So good nutrition, we see it's about variety and balance. It's not going to be, based in fear. And without a balanced approach, blood sugar management and overall health is possibly going to worsen. And so we also see, impact on glycemic control. It's going to be harder to maintain stable blood sugar levels, especially if you have increased stress, right? All these things in the world impact your blood sugar, including stress. So if you're cycling through a stress and fear and anxiety around your food choices, your blood sugar could result in trending higher because you have that higher cortisol level and stress hormone. One of the worst things is avoidance of medical care. So, shame or fear of weight based judgment or even food based judgment can lead someone to miss appointments or hide behaviors from their healthcare provider. And we always want to create an environment where patients feel supported and seek their care and encouragement and empowerment when they're dealing with diabetes because it is complex. And so, we're looking for compassionate care so that we can have better glucose control, but also better mental health, well being, and overall health. Um, and this is where we also see undermining self-trust, right? If you feel like food fear mongering is an issue, it can erode in your confidence on your ability to make decisions about eating. Like all these messaging online, I'm like, I can't even buy a snack food without it being bad for me. So when you constantly get bombarded with conflicting messages about what's safe or dangerous or what to eat, it's really, really easy to start doubting yourself and your ability to make choices to support your health. And that can lead you to rely on the external cues and external rules that, strict diets that come out online or something, your neighbor told you to do. You get reduced intuition really in developing, when you're hungry and when you're full. How do you identify that? Sometimes we ignore those signals and we really want to work on getting back in tune with them because that helps with our portion size and regulating our hunger hormones. Lower motivation is also an issue too, where you're feeling discouraged and powerless in your ability to make these choices and stick to a plan. And it makes it hard to build trust in yourself for a long-term success and a positive relationship with food. So, like I said, it's more of a domino effect where diet culture kind of creates this cycle where you're constantly either in fear mongering, feeling anxiety, you make bad food choices, you avoid foods, nutrition issues. So, in summary, the fear-based messaging around food, it creates that cycle. And so diet culture undermines the mental health and diabetes management by promoting shame or disordered eating and even body dissatisfaction. So a shift towards more compassionate and individualized and weight neutral care can really help protect the mental health and support really sustainable self-care practices.
So, for someone who's lived with diabetes for a long time, how hard is it to unlearn those diet culture messages? And how can we help them with where to start?
That's a good question. Because even with some without diabetes, it's really hard to unlearn it, but it is really possible. I even find myself having to like go through like the truths in my head of like, wait, is this research based? But it can be emotionally and mentally really challenging, especially because there's such an overlap between diabetes management and diet culture. So it can be hard to kind of detangle it all. And many people with diabetes have been told for years, like decades even, to focus on restriction, right? Control, numbers, restricting. And it often reinforced this fear based or moralization of the types of foods that you're eating. And so, why it's hard is because diabetes education is traditionally centered on weight loss and carb counting and limiting quote unquote bad foods. So, common things you could hear is like, you need to lose weight to get your blood sugar under control. That's just one little piece of the puzzle, right? We know diabetes involves real concern about complications, and diet culture uses that fear to push restrictive behaviors rather than really, sustainable ones. So, like, where you can start would be like redefining your health beyond numbers or weight, and you could start by asking yourself self-compassionate questions like, how do I feel after eating this? Are you satisfied? Do I feel energized? Right, you're getting in touch with how the food is specifically making you feel. You can even learn a little bit more about weight inclusive diabetes care. We will have a future presentation about health at every size, where we talk about, health can exist at every single size. You can have healthy habits anywhere, and that especially applies to diabetes. And you can absolutely intuitively eat with diabetes. Um, this also involves kind of challenging, your old thoughts. If you think of a negative thing surrounding food, like I can't have this, or an external food rule, you kind of reframe that thought. Is this belief, helpful, or is it harmful to my relationship with food? Or approaching your meal with curiosity rather than judgment. We do that a lot in counseling when we look at our numbers. Instead of feeling shame around a high blood sugar number, let's look at it with curiosity. How could we get it down next time? What do you think specifically caused that? How are you feeling? Do you feel full and satisfied, right? So it helps you to create some sustainable change around something that might just be a high blood sugar, or maybe a certain way you're feeling. So it helps us to create a more sustainable approach. Also, finding community. So, support groups or online spaces that aren't centered on weight loss, super empowering. I know Donna and I can go through where we can find how to register for our diabetes support group, which is on the fourth Wednesday of every month, usually at 6 p.m. And so that's a great place to start, because you're talking with other people about how to manage your diabetes and how to manage your numbers and talk about food in a really safe space. And we try to avoid diet culture conversation and more so focus on those sustainable habits and change that support um, mental health, physical health, all well-being. So your relationship with food and body and self-trust deserve healing too. You're still allowed to care about, your weight and your health, but it can be all-encompassing and multifactorial.
And I'm glad that you mentioned about the support group because I had attended several times as well. And so we tend to get a nice mix of regulars who come month after month, as well as, some usually a couple of new people each month. Each month is a little different, but I think the important thing is they start sharing what each other. So they share what they've learned through nutrition. So it's good to see it through someone else's eyes as well, and sharing how they've overcome some of the obstacles or barriers in their journey as well.
Absolutely. And you don't feel as alone, right? Diabetes can be super isolating, especially if you don't have anyone in your circle to talk about it with or deal with it. And so having other people who are going through similar situations or have tried something that has worked for them, there's usually two of us RDs on there. So we're there to answer any questions and support that conversation. So very, very helpful resource. And we also talk about carbs a lot, which is great because carbs are not our enemy. And we want to really kind of break down a little bit, because I think this is one of the main focuses that we see with diet culture and fear mongering with diabetes management is carbs, right? There's this huge fear around carbs, which are one of the three macronutrients. There are only three, and all three are very important: carbs, fat, and protein. And chemically, carbs are made up of sugar, starches, and fiber, all which give your body energy. So, what we're going to kind of walk through what carbs do for us, and how we can eat them in a sustainable way. So, when you eat carbs, your digestive system is going to break it down into glucose, into a simple sugar that your body uses as a primary source of fuel. That glucose is going to travel through your bloodstream to your cells, where it's going to immediately be used for energy, or it's stored for later use. And this energy is going to power everything from your basic functions like breathing. A lot of people don't realize that glucose is powering you just to sit here, and thinking, to physical activities like walking or exercise. It is your body's main source of energy. I don't think I would ever recommend anybody cut out carbs completely, because it is the preferred source. Your brain and your muscles and organs rely heavily on glucose for energy. And without that carb, your body really has to find an alternative source of fuel, which is less efficient. You often hear the keto diet and that brain fog, right? That's for a reason, because your body's trying to function on something different. We know it also carries fiber benefits, right? So many carb rich foods are providing fiber, which is supportive in digestion, blood sugar stability, heart health, weight health, right? So all of carbs are having a lot of health benefits to them that we don't even realize. And a lot of us tend to be overly restricting carbs. Sometimes if you have cravings, right, you're skipping carbs during the day and you're like, I'm craving all the sweets at night. That is for a reason because we are under eating carbs. And so we really talk about how to introduce carbs in a safe way, and how much, right? So that can differ based on the person. Recommended guidance is usually about 45 to 65% of your daily calories. But with blood sugar differences among individuals, we can change that. A minimum, we usually like to say 130 grams per day or more. 130 grams is really that minimum that we don't really like to go lower than, just for supporting your body's metabolic needs. Um, but depending on your calorie needs and your nutrition profile, like we talk about in counseling, and your blood sugar stability, we can adjust these numbers for what fits best. So it's personalized. And even with diabetes, we are eating carbs. So instead of eliminating, the goal is to manage how much, what kinds you eat to help keep the blood sugar in a nice and stable range. And even cutting them out can make your blood sugar a little wonky as well. So the key is choosing a balance of the quality, the type, and to provide nutrition without causing extreme blood sugar spikes. There are a couple types of carbohydrates. We've got simple and complex. Simple are made up of two or more sugar molecules, and they're quickly digested and absorbed. So they cause your blood sugar to kind of bump up fast. You can usually tell, like honey, candy, sugary drinks, your fruit juice. And complex carbs are made of longer chains of sugar molecules that take a little bit longer to break down. They usually contain the fiber component with the vitamins and minerals. So we tend to say eat more complex carbs, which would be your whole grains, your legumes, your vegetables, even starchy vegetables. It slows down our digestion, keeping our blood sugar nice and steady. And then fiber is the third option under that little umbrella of carbohydrates. And fiber is the type of carb that your body cannot digest. So it passes through your digestive tract mostly intact and has all those health benefits, improving digestion, lowering cholesterol, slowing glucose absorption, really the underdog of all the nutrients. And we can, of course, find those in vegetables, fruits with the skin, seeds, nuts, whole grains, legumes. And so we want to encourage the use of carbohydrates regularly, right? Small, frequent intake throughout the whole day, a consistent carbohydrate, and a flexible eating pattern. So managing carb intake doesn't mean cutting your carbs out completely or eating the same exact amount every single day. Your body can do all different things every single day. You do the same thing, your blood sugar can still go up, still go down. So our goal is to have flexible eating. That means you have options. You can adjust your portions based on your hunger, your activity level, your blood sugar goals. Some helpful tools here might be the My Plate portioning method, which we've definitely shown on webinars before, but it's half of a plate of vegetables, a fourth of the plate of carbs, a fourth of the plate of protein. Or you could use, if you prefer hand portions, usually say like 2 fistfuls of veggies, about a palm or more of protein, and about like a fist of carbohydrate or complex carbs if we can help it. So carb counting, I mean, there are carb counting and apps that you could use to track that intake if you're really looking to manage those sugars on a tighter range. But I always say tread lightly with those because we want to make sure mental health wise, it's not an anxiety trigger for us. And that flexible eating really helps us to enjoy a variety of foods without feeling restricted. It also helps you to respond to how your body feels and how your blood sugar responds to different meals. That's essential. Learning how your body responds to carbohydrate can help you manage your diabetes so much better. And we work a lot on this in nutrition counseling. There's also a really important role in medication and movement. Carbs are part of your overall diabetes management along with these things because, I mean, medication or insulin, it helps your body handle the glucose from carbs, right? Medications are a tool to support your body in managing that blood sugar effectively. And they don't mean that you have to avoid carbohydrate completely. Sometimes, especially with insulin, we don't want to avoid carbs completely because that could result in some blood sugar instability as well. Movement is also super important because physical activity helps your muscles use glucose for energy, which improves blood sugar control and your insulin sensitivity. So even light to moderate movement, walks after meals makes a difference. Don't let any fear mongering online tell you otherwise, that it doesn't count. It absolutely counts. And so carbs are an important energy source and they come in lots of forms. And we obviously want to prioritize those high fiber whole carbs. use that flexible portion sizing and those strategies that fit your lifestyle and your preferences. And then we also have medication and movement that work together with your diet to support really healthy blood sugar levels. And then remembering that carbs are part of the diet, right? They are not the enemy. The less we fear, the better. And managing them thoughtfully can really, really help you feel your best every day.
So Caroline, what are some common messages that people with diabetes hear about food that can actually do more harm than good? And I think that kind of goes back to what you were talking about yesterday, where sometimes we just hear something without knowing the context behind it,
Yeah.
or whether or not it really is backed by research and science, or if it's just something someone said, right?
Oh, yeah. And there's, especially even like carb wise, like carbs are the enemy. I hear that one a lot. Or like, if you eat this, your blood sugar is going to spike uncontrollably. Or this one is going to like mess you up altogether, like your diabetes management. Or someone with diabetes should never eat this food. And that is like, that instills fear in me. I'm like, wait, what? Should I not be eating this? And so it creates a cycle of fear and anxiety around food rather than really helpful guidance. And so all these claims are really oversimplified. Yes, candy raises your blood sugar. Like we know that. Okay, great. But doesn't mean you have to avoid candy forever, right? Because that results in restriction and binging and just not having a healthy relationship with candy. So instead, it's we see it as complex, right? How do different foods and individual bodies interact? And it's we want to create an individualized plan for somebody rather than them dealing with guilt and shame on the forbidden foods that like they consume. So framing foods as good or bad reinforces that moral judgment and like very black and white thinking, which also then harms your self-esteem and makes really sustainable management harder. So instead of like empowering people to use and understand and know how to work with their bodies, the harmful messaging often promotes like those disordered eating thoughts and patterns and reduces joy and social connection that food can provide. So I think a lot of us, especially in the diet culture realm, like forget that food is supposed to be joyful and it's like community and like it's things we celebrate with. It has so much more potential than just fuel. And so having an all-encompassing perspective of that is really a first step into like exiting the diet culture realm and trying to have a more wholesome approach to your diabetes management. Let's see, and that actually goes really well with our next our next slide of how do you identify what is a good source. Um, we can talk about like common myths in food and diabetes management, especially because there's just so many like narratives circulating online, like people with diabetes can't eat sugar in moderation, like you got to avoid all sugar. And the key, like we said, is managing the carb intake, balancing with your blood sugar needs, using medications and movement to help regulate those levels. um, One of my favorite ones that makes me laugh is eating too much sugar causes diabetes. I've heard several people be like, you got to watch that cake, you're going to get diabetes. You're like, okay. So, diabetes is caused by like a combination of genetic and lifestyle factors. Eating excessive sugar alone does not directly cause diabetes, but we know poor diet and obesity and lifestyle choices can absolutely increase your risk. So it's risk assessment. It's not just that cake is causing diabetes, or if you have a sweet tooth, it means you're getting diabetes, right? Someone can get diabetes strictly like from hormones, right? Gestational diabetes. So that's a lot more complex than just eating sugar. Carbs should be completely avoided. We know this. We talked about it. Um, Main energy source. We should monitor it. Um, Diabetes means you can never enjoy sweets or desserts, and that just makes me sad because what is life without like a sweet treat? Sweets can be enjoyed on occasion, of course, as part of like your balanced meal, and especially if you adjust other carb intake and monitoring blood sugar levels. We talked a little bit about this in a previous webinar when we talked about building your plate, and you can like do some carb exchanges, right? If that cake is more important to you, like we can adjust the carb at the meal to kind of balance out some things and monitor your sugars and the response that you get from eating a certain food. One I hear very often is fruit is bad for people with diabetes because it contains sugar. So many people come in saying they have to avoid fruit, and we just that is not right because fruit is very like nutrient dense. It's got fiber, it's got vitamins and minerals. It is not the same as eating a candy bar because the candy bar doesn't contain all of those health beneficial items, right? And so eating fruit is in reasonable portions, which we talk about in nutrition counseling, what does that look like, can absolutely be healthy for people with diabetes. So those are some of just like random myths kind of circulating, and just shows the misinformation that is online. But some red flags to keep in mind. Too good to be true claims, right? If you're seeing it cures diabetes, or buzzwords like detox and cleanse, just steer clear. It's not going to work. It's not a substitute for the medication your doctor has provided. Lack of credible resources, right? Claims from experts who have zero credentials. Definitely avoid that. Overgeneralization, like everyone with diabetes should avoid this one food, or no sugar at all, right? It's not as simple as that. Anecdotal proof, right? It's just testimonials. I cured my diabetes doing, you know, X or whatever. Selling products or diet plans. These are often a goal of profits and definitely not education based. So buy my supplement. Yes, probably not the most sound research. Fear mongering, guilt tripping, right? They make you feel bad for doing something. Ignoring medication or medical advice. So this one's actually pretty dangerous, right? If a post or an article is telling you to stop or avoid prescribed diabetes medication without consulting your doctor, definitely avoid that. That is harmful, and dangerous advice to follow. Lack of scientific explanation, right? Your food lowers the blood sugar instantly, but it doesn't give you any context, does not source a resource or a peer-reviewed study, right? That is not information you want to use. Conflicting or contradicting information that you see, 1 month they said this, the next month they said that, and they just don't agree. Usually means someone's really not paying attention or cherry picking information that they might find online or in studies that just don't have any context. So, how do you find a credible source, right? You want to start with reputable organizations. I think that's a great place to start. The American Diabetes Association, the American Heart Association, there's the Digestive and Kidney Disease Association. You could do World Health Organization. There are tons of government-funded websites that are very helpful and easily accessible for you. Check for .gov, .edu, or .org as that little handle after the website, just to give you a more credible resource. Also verifying the date, that's important. We want like preferably within the last 3 to 5 years, that it's like a recent advancement, because nutrition and science evolve, right? The guidelines for nutrition 50 years ago are definitely not the same as what we're following now, because we have more research, we have more information. So you want something up to date. You can also check the author, right? A lot of times with little articles, I'll check the author. Is it written by a registered dietitian, a doctor, an endocrinologist, someone who's been specialized in that field, who can give you credible information and who has been trained to read research studies pertaining to their field. A lot of the times you'll just have random people tell you about this study, but they have zero experience, reading like a peer-reviewed study. Like they have zero experience on how to interact with that study. They just find one little piece of information and go with it, but it has no context on what the other aspects of that study mean. And consulting your healthcare professional. If you have concerns, questions, I would love if someone just like brought me in an article and said, "Hey, I read this online. Is this true?" Because I'd love to talk about it. So I'm sure doctors as well want to share their expertise. They want to make sure you have the most credible information that you can make health decisions based off of. And so they'll really recommend even reliable sources tailored to your specific needs.
So, kind of going back to some of the terminology that you've been using, what does a weight neutral, compassionate approach to nutrition counseling look like for someone who maybe is just newly diagnosed with type 2 diabetes?
Yeah, and especially newly diagnosed with type 2 diabetes, everything's kind of new, right? You've got a lot of like pieces you're trying to figure out. And I think the main focus would be like building a respective, maybe collaborative relationship that centers on a person's really lived experience, their values, their goals, rather than just weight loss alone, right? Weight loss is just like one key piece. And instead of prescribing restrictive diets or emphasizing body size, like the provider or I would explore like how food is going to impact their energy, how it makes them feel, their mood, their blood sugar levels, unfolding really the story, right? It's not just as simple as don't eat this, don't eat that, which a lot of patients want to come in just to be told that, but to have longevity and like longer and sustainable blood sugar levels, it starts with kind of unpacking your relationship with food. How do we eat it? When do we eat it? Why do we eat it? Offering really flexible strategies like adding fiber and protein to your carbohydrate to balance your blood sugars. It can be super simple, just like a small little change, nothing crazy, nothing that's really hard to maintain. And that really supports metabolic health without shame or like really rigid guidelines. And education should always be about empowerment, not punishment, or to make you feel, guilt or shame about any of your choices. Because you are your own person, right? You know your body best, and we should approach things with curiosity on how to support you best through your health. Especially if you're learning, right, how your body is specifically relating to like or digesting carbohydrates and reacting to specific foods. This also creates a lot of space for like cultural food practices, right? We don't want to just like tell someone who eats rice on a daily basis to just cut out rice. Like that might be part of like their cultural norm, and we want to support that. And how do we eat rice, and what can we do to increase the fiber, and asking more questions and putting an emphasis on that sustainable nourishing care, not the perfection, not the size of the body, not, fully cutting things out. It's really more of like an all-encompassing, overarching well-being supportive system and compassionate system, hopefully to help with the management, especially with someone who's very nervous starting their diabetes journey. And with that, building a healthy relationship with food, right? So that's what, compassionate care looks like, is we want to also talk about, building a healthy relationship with food and how to do that. Neutral language around food, right? A lot of us have heard food described as good or bad, allowed, off limits. And this labeling really kind of creates that stress or guilt, which isn't going to be helpful. And so thinking about food in a neutral way, right? Eliminating the labels on food or the morality around food. Some food raises our blood sugars faster than others, and that can help us make more balanced choices. But it doesn't mean you have to completely avoid things altogether. So we can shift the language we use and say, instead of saying like I can't have sugar, it might be more helpful to say I'm choosing to balance my carb intake through the day. So maybe I'm not going to have this item now, but maybe I will save it for later. And this neutral language like helps to focus on what your body needs and supports more of a positive mindset around eating. And this also creates a really empowered eating experience, which means you're in control of your food choices, not your diabetes, not anyone else. You get to make the decisions about what's going to fit best for your body, and you know how your body's going to react. So it's about tuning into the hunger and fullness cues, deciding when to eat based on your needs, preferences, blood sugar, and lifestyle. And so we talk a lot in counseling about responsive eating. And so it's, take your blood sugar before a meal, take your blood sugar after a meal. How did the food affect you, right? You're eating in response. Or if you start a blood sugar or a meal before, if you start a meal and your blood sugar is high before you eat that meal, maybe we want to take a look at the carbohydrate content. Maybe we want to focus more on the protein and fiber, right? We're getting a little bit more flexible with that eating schedule and responding to how our body is acting in that exact moment. So, empowered eating really encourages you to experiment, listening to your body and seeing what feels like satisfying and sustainable. More so about balance, not so about perfection. And then sustainable nutrition goals. The number one thing we talk about in nutrition counseling are smart and sustainable nutrition goals where it's not following a strict diet or a quick fix to manage diabetes. There's no one answer, right? It's a lot of the tweaking and seeing what works, and you're not a robot, right? You change in different seasons, you have different needs in different seasons. So we focus on setting really small and realistic goals that fit your preferences. And it could be as simple as adding an extra serving of vegetables, or maybe you're going to switch to whole grain bread, or you're going to plan a snack. And these goals really help to support health in the long term. And when they feel achievable, like when the goals feel achievable or enjoyable, you're more likely to stick with them. That leads to consistency, better blood sugar control, and overall well being too.
So many people believe that managing their diabetes means they have to have weight loss, right? That goes along with that. But how do you respond to those comments or the patient's beliefs in that?
Yeah, that's a good question because I feel like we come from like a very diet culture weight centered system, right? We had commercials, I think of like the itsy bitsy teeny weeny yellow polka dot bikini. Like when I think of diet culture, that's the commercial that pops into my brain. And it's important to understand that health and diabetes management are about like much more than that number on the scale, right? when weight loss, like sometimes, of course, we see improvement with blood sugar, but usually that improvement's usually from the behavior changes that are occurring to result in that weight loss. So taking the stress off of those numbers is really going to be helpful because we can measure the behavior changes, right? We can tweak them. We can't really have direct control of the weight. I can't just tell my body lose 2 pounds and it loses 2 pounds, but I can walk more. I can change the types of foods I'm eating. So focusing solely on weight can lead to that frustration and the shame and the restrictive behaviors that are really, really hard to sustain. So instead, we say let's focus on consistent compassionate habits that support stable blood sugar and overall well-being, and then regardless of your weight change, right? Sometimes in nutrition counseling appointments, we don't talk about weight until like later on, right? We talk about first, what can we change? What do you feel like you need support in? Because your health is way more about how you feel and how you function instead of just size. Those healthy behavior changes result in way better health outcomes than just the weight alone. So we really take that perspective on health at every size to focus on the behavior change over the weight. Weight is just a measure. It is an important risk factor, absolutely, but we want to focus on the things that we can change directly that results in maybe improved weight maintenance over time. And some practical tools and strategies even. So planning a meal without restriction, right? Doesn't mean you have to follow strict rules, cut out your favorite foods. Instead, we want to create balance while keeping an eye on the portions for your blood sugar control. So thinking meal planning like a flexible guide. You are not a robot. You have things happen throughout the week that might throw off a meal plan. So that's really why it's great to have flexible eating schedules and not a rigid list of do's and don'ts. This helps to reduce that stress and makes it easier to stick with the habits lifelong, long term. We also have mindful eating and blood sugar logging. So, mindful eating means we're paying attention to how, when, and why we eat, and it helps us to slow down. We're going to savor the food, notice the hunger and fullness signals, and this can really help prevent that overeating or eating out of habit, stress, emotion. And then when you pair this with blood sugar logging, it's pretty empowering. You get to see exactly how your eating response impacted your blood sugar levels. And that helps you to create some sustainable change with maybe I'll do this, maybe I'll do that. Getting curious and excited about making some changes because you're noticing a difference. And it helps you to feel that you're supported in your health rather than overly restricted. There's a connection between mindful eating and your blood sugar levels overall in general. We also see the gentle nutrition and food rules. Like if you're thinking, gentle nutrition is more about nourishing your body with like kindness and flexibility rather than the strict rules, those can feel overwhelming and guilt inducing even. So instead of saying like, I can't have this, I must, or I have to eat that, gentle nutrition encourages that balance and moderation rather than relying on those external food rules that we've been told over and over again. And this mindset really helps to reduce that anxiety around eating and support more positive and sustainable approaches to our nutrition plan. Affirmations, I think, is even one of the most important little practical tools and strategies that we can use because we want to speak positive things, right? If you're thinking like negative thoughts surrounding food and you have anxiety surrounding your food choices, start to say things like I'm learning and growing every day, or I make choices that support my health and my well-being, or it's okay to enjoy food without guilt. This does take time, right? If we've had a long history with diet culture narrative, it takes some time to start with those affirmations, but the more you tell it, the more you start to believe it's true, right? And it's a more compassionate way to speak to yourself rather than saying, I was so bad, I had a pizza. Well, did you enjoy that pizza? Was it a fun time with your family? Great. So it's kind of changing the narrative around how we talk to ourselves and how we talk about food. So repeating the affirmations can absolutely boost your confidence and reduce stress, help you maintain balanced approach to eating and your blood sugar.
So one final question. How do you handle the tension between giving people the tools that we've talked about to manage their blood sugar and not making them feel like they're failing if they don't follow strict rules?
That's a really good question too, because a lot of us think it's like a lack of willpower, right? If we can't accomplish a goal, if it's my willpower, it's my problem. Usually I say, you didn't fail the goal failed you, right? We can always modify. So handling this tension really starts with shifting the focus from that strict rule and perfect numbers to learning more self-compassion. You're on a journey, right? Like you've never had diabetes before. You're learning more about yourself. And when you kind of go with that open perspective, and emphasize, that diabetes management's a journey and has ups and downs, not like willpower and a sense of your worth. Reframing that is really, really helpful to encourage curiosity about what your body's telling you and celebrate the small wins, right? Like I ate an apple and controlled my blood sugar. Like that's a win, right? And adjusting things along the way, like, okay, well, I know this fruit affects me this way and this fruit affects me this way. My blood sugar is already running high, so maybe I'm going to choose this different fruit just to support my blood sugar levels. So it helps you to feel really empowered rather than controlled by the diabetes process, right? So we should feel empowered and encouraged to continue to make these decisions about controlling our numbers and our health overall. So by normalizing, imperfect and validating your emotions and how your diabetes experience is going, we can really create a supportive space where we can make people feel like they've regained trust in themselves and their ability to kind of make food choices that support their blood sugar for long-term management in more sustainable and less stressful ways. And so to wrap it all up, because we've covered basically everything diet culture wise and diabetes management, some key takeaways is food is not the enemy. The misinformation is. If it sounds fishy, if you have any questions about it, it probably is. So food, it's not meant to be so complicated, right? We just have to approach it in a really curious way. You can manage your diabetes without fear or guilt or shame. Food doesn't have any morals, right? It's just an inanimate object. It's not good, it's not bad. And so, balance instead of perfection is going to lead to that long term success over time. And that's what we as dietitians are here for personalized support because your experience is different from the next person. And we truly believe that you deserve the best, most individualized care to support your specific health needs. Any final questions?
I don't think so. But
Hi.
I did want to circle back to what you had said earlier. And so, one of the things, if you want to stop
Yeah.
sharing, Caroline, so to kind of wrap this up, what Caroline said is, our dietitians have done a lot of work to help support and give that individualized care to our patients. And one of the other things that we do, so these webinars that we have are just a small portion of the things that we try to do. You can see our website now, Caroline.
Hmm.
Okay. So in addition to certainly meeting with the dietitian one-on-one is very important because they can help you directly. But in addition to that, on our website, which is umusa.net, we have this area here for patients. And then under our wellness programs, we have the diabetes and nutrition program. So we try to keep all of this in a centralized place to make it easy for our patients to have resources to go to. So this introduces all of our dietitians, talks about our program. But then down here, we have several sections. These are educational handouts, so they help you with a variety of things, even giving you some meal shopping tips, giving you some meal plan ideas, um, and a bunch of other things. I'm not going to read them all, but there's a lot of good um, information out here as far as handouts. We also have a link to some community resources, and then we originally started out with some quick tips, so we do have those out here. They're just 3 to typically 5 or 6 minutes, quick tips on a variety of things like meal prep, mindful eating that Caroline mentioned throughout this webinar. And then our webinar series are down here. We have them going back to the first year that we started this during the pandemic, right? We were trying to figure out another way to get information to our patients. So they're all here by year. And then we also have the topic. So clicking on that link will take you right to our YouTube site. You can listen to it while you're taking a walk, you know, preparing your meals, doing things like that. I mean, they are a video and we usually have a presentation there, but even hearing it, you know, will help you with some ideas. So all of these things are out here. And you can feel free to, you know, go out there and peruse and, you know, click on any that you may find, interesting.
And I think that, forgive me if you mentioned this, the top of the screen had the support group link that you could click to register. There should be a little button at the top where it says register for diabetes support group, I believe.
Sorry, I knew we had the ad at
Certainly
the
do.
bottom. So we do have the ad down here for the wellness webinar as well as the support group. But yes, to make it easy for you, if you click on here, you can register and then it does keep you in the series. If we have your email, then typically that week, 1 to 2 days before the session, we do send out an email reminder for everyone, just in case, you know, they forgot for that particular month. I'm sorry. I thought I was still sharing. I do apologize. I'm going to go back here, Caroline, just for a quick second. Maybe. Okay, sorry. So back on the same site, there is this blue area that says register for the diabetes support group. So if you click on that, it will take you to what Caroline was talking about. I apologize. I forgot that I had stopped sharing. So going back there. But again, just our last reminder, next month, our plan is to have Dr. Aparna Hasmani with us to talk about eye care, eye health, the importance of your annual diabetes retinal eye exam. So with that, I want to say thank you, Caroline, as always, and we look forward to seeing everyone on our next webinar. Thank you.